This is Dr. Pieter Cohen. I'm one of the clinicians at Cambridge Health Alliance's COVID respiratory ambulatory clinic. We've seen over 650 patients who we've evaluated for shortness of breath during the pandemic. And I wanted to share with you today some tips that we're using, or trying to use, to distinguish COVID from some of the other common illnesses that it might be confused with. So one of the most common diagnoses that we worry about when we're seeing a COVID patient is community-acquired pneumonia, of course. So let's first take a look at community-acquired pneumonia and think about it if there's any way, as clinicians, we might be able to distinguish patients who have community-acquired pneumonia from COVID. What we're trying to do here is focus entirely on information you can elicit from history or a simple exam. Here in clinic, we don't have access to labs or even chest x-rays. So this is pre-hospital evaluation that we're talking about. When it comes to community-acquired pneumonia, the typical presentation, although of course not always, is that patients begin to have fever and might feel tired or fatigued. So of course the fever and fatigue is very similar to what would initially develop with COVID. What happens most often with community-acquired pneumonia is a few days after you start feeling ill, or maybe the next day, is that patients develop a cough. So a cough might develop maybe on day 2 or 3. And then the cough may or may not become productive. And as we see, this is a little different. Fever and fatigue, shortly followed by cough, which might be productive. This is a bit different than the fever and fatigue of COVID, which, if there's going to be cough, would have started early, along with the fever and fatigue. But with COVID, it's dyspnea that develops. And with community-acquired pneumonia, it's really if the pneumonia continues and is not treated that significant dyspnea develops. Another potential overlapping diagnosis is post-viral pneumonia. Post-viral pneumonia might begin with just a bronchitis, cough, maybe a mild fever. So here we have the cough being the start of the symptoms. But if one were to develop a post-viral pneumonia, then after the cough and fever develops, one might out here, maybe 5-10 days later, develop increasing fevers or increasing productive cough. Again, the dyspnea might follow later, more commonly. Whereas with COVID, we're seeing the dyspnea is starting here, and that patients generally are not developing new productive coughs on day 4 through 8. They're developing dyspnea. Another potential diagnosis is influenza. That, of course, will depend on the prevalence of influenza in your community. But the typical presentation of influenza, that it starts suddenly. People might even be able to identify the hour that it began. Feel exhausted, need to lie down, have fever, cough, and sore throat, a variety of other symptoms, and usually all the symptoms start at once. This is actually very similar to the more symptomatic presentation of early COVID. And if you just have that presentation, there would be no way to distinguish influenza from a clinical perspective from COVID. What happens next is what's a bit different. So with influenza, you're generally in this state of illness for maybe 3 to 5, 6 days. But there shouldn't be new symptoms developing. It's more a steady state of feeling exhausted, worn out, sick. If new symptoms develop in influenza, like dyspnea or new higher fevers, then we're worried about complications of influenza. Maybe a post-viral pneumonia, or maybe in the very rare case of a influenza, viral pneumonia. But regardless, influenza generally hits you hits patients strong at first, stays that way for multiple days, and then improves. Different than COVID, which might hit you strong in the first few days. You might feel knocked out, but what's different is the new dyspnea that begins to develop after day 4 through 8. Another diagnosis that we should be considering, and not forgetting during the pandemic, is pulmonary embolism. So always remember to think through if someone has risk factors for a pulmonary embolism. And let's think a little bit about the distinction between the presentation of PE versus COVID. So with a pulmonary embolism, we might expect that one's respiratory rate increases. But in general, if it's not a very large PE, the O2 sat will remain normal. And in COVID, if we have a COVID presentation, the respiratory rate that we have seen has only been elevated when people have low O2 sats. So this is potentially normal. But with COVID, we would expect, if someone's respiratory rate was significantly elevated, that their O2 sat would have declined. Another very common challenge is distinguishing anxiety and shortness of breath from anxiety from COVID. This is so common because of all the news and all the focus on how serious COVID could be. So many people are very worried. So I can just share with you some of our tips that we use in clinic to try to tease the shortness of breath from anxiety from the shortness of breath and dyspnea of COVID. First off, it's when the shortness of breath begins. What we've seen with anxiety is that if someone has any viral symptoms, almost immediately, within hours, they start having trouble getting air into their lungs. Now, remember that COVID, the dyspnea in COVID, takes maybe 4 to 8 days to develop. So if one, on the exactly same day that they're developing fever or cough or a sore throat, starts feeling that it's hard to breathe, our clinical suspicion for COVID is a little less. However, we would certainly test those patients to help us make that distinction. Another tip for trying to distinguish anxiety from a COVID-related dyspnea is the patient's description of the shortness of breath. In COVID, the shortness of breath is going to interfere with daily activities. It will get worse if you go up a flight of stairs. If you're trying to cook or take care of someone, the shortness of breath will worsen. What we hear from patients who are anxious and developing trouble breathing is that it's more of a sensation, that it's hard to get air into the lungs. And often, our patients are able to proceed with the normal chores of the day without any problem, and actually don't even notice any shortness of breath when they're doing their chores. But when they stop and sit down, or they're trying to go to bed at night, they have a feeling of suffocating or inability to get air into their lungs. That might be a hint that shortness of breath is coming from their anxiety related to the virus rather than the virus itself. Other diagnoses to keep in mind are acute pericarditis. Asking a patient who develops sharp phleuritic chest pain if sitting up and leaning forward relieves that pain or lessens the pain might be helpful in distinguishing acute pericarditis from other diagnoses. Strep throat, also very similar to COVID, because COVID can absolutely present with fever, sore throat, just like strep throat does. The difference is that if you have strep throat, between days 4 and 8, you're not going to be developing dyspnea. And in fact, if you don't have complications of strep throat, it will resolve on its own. But of course, we would recommend treating it earlier when appropriate. And finally, for patients who already have known asthma, congestive heart failure, COPD, it's very important to keep in mind that they might have exacerbations of those illnesses that might have occurred without the pandemic, or that they have a mild case of COVID and that triggered an exacerbation. in those situations, it's very important to keep that in mind. Is this the typical presentation that they have when they've had exacerbations in the past? That's so important because we don't want to miss treating an asthma exacerbation because we presume it's COVID. And we don't want to miss appropriately treating a CHF exacerbation because we think it's COVID. So I hope that these tips today from Cambridge Health Alliance's Respiratory COVID Clinic can help you better distinguish COVID from some of the other common respiratory ailments that will certainly occur during this global pandemic.